Yes, in a petri dish, when you give glucose to cancer cells, they grow. We don't think it's necessarily the same relationship in a person. However, in general, people are healthier if they have a moderate level of, carbohydrate intake. Yes, sir.
Dr. Blanchel, I was really pleasantly surprised to hear you were a speaker today. I know I'm one of your new patients. About a month ago, I became one of your patients, and I expected to receive chemo when I came to you. And you suggested protons. And I've had one treatment, and I just want to be available for anybody who's interested afterwards. And I'm really glad that what you did for me. Thank you very much.
Thank you, John. I think what you just said is huge. All of this is scary for patients. It's one thing to hear me talk about, oh, this is well tolerated, or these are the side effects. I haven't gone through this treatment. So I appreciate you volunteering to talk to people specifically about Provenge and, just your treatments in general. Thanks, John.
Thank you.
The Provenge is the only immunotherapy or anything else? We have already talked about immunotherapy.
The question is Provenge the only immune therapy for prostate?
Right.
Yeah. So it's the only one that's FDA approved for prostate cancer. That being said, if your cancer has a high number of DNA mutations, some of the checkpoint inhibitors that we use for other tumor types may be appropriate, but they're not approved yet specifically for prostate.
Does immunoglobulin do any good for cancer?
For prostate, probably not. So immunoglobulins are proteins that can be produced by the immune system. When people have certain forms of myeloma or other blood cancers, those cancers may produce high levels of immunoglobulins. I'm not aware of any treatments that specifically target them. If your immunoglobulins get too high, that can cause organ damage because it's excess protein circulating in the bloodstream, and it can affect people's ability to fight infection. But I'm not aware of there being a role for immunoglobulins in general for prostate.
To get your BRCA, if there's a mutation there,
Yeah.
what is the test called?
The test that's used through SMH, I want to say it's called Invitae, I-N-V-I-T-E. There's a number of different commercial tests that can look. All of them have a panel of a limited number of genes that they look for in prostate. So BRCA1 and 2, ATM, PALB.
23andMe, is that what?
No, well,
Is it just a genetic?
so 23andMe, that's an interesting question. It is a genetic test that'll tell you about your own DNA. I don't know how in-depth it goes with the variants that we know are associated with cancer when we think about some of these syndromes. So before you sign up for it, I'm assuming they give you the whole printout of all the genes that they're testing for. It's not something that we commonly recommend for cancer screening. It's a good question, though. I don't know. That'd be a good genetic counselor question. Because financially, let's say that you don't have coverage for the cancer screening. I don't know, how much is 23andMe? A couple hundred, probably? Okay, so that's actually pretty reasonable. I don't know if it's exactly the same panel.
I'm really, excuse me, but I'm not sure if I understood most of what you said, but sorry, but listening very carefully. If, let's say we make an appointment, we come to you, can we start with immunotherapy, or does my husband have to start with the test first? Do you have to get a genetic test?
No, so not to get too far in depth, I know you said your husband had bladder cancer.
Yes.
Bladder cancer is one of the cancers where immune therapy is approved for metastatic disease,
So we can start with that.
depending on your husband's stage.
So
Yeah.
how do we start?
So probably what would be best, because we'd have to go through a whole health history for your husband, would be to schedule an appointment. And I have cards back there that you can call. Yeah, absolutely.
Is the information that you've just given us available to oncologists? My experience so far has been, when I was diagnosed with prostate cancer, the alternatives they gave me were either prostatectomy, seeds, chemotherapy, no one ever brought chemotherapy, but radiation, but it was all like a physical way to handle it. So I've chosen one type of therapy, which none of them ever brought up, called proton therapy. But why do they not know what you just told us? or how do I?
It's not that. Just from what you said, I'm assuming when you were diagnosed, it was felt to be contained within the prostate.
Yes, it is.
And curative. Curative treatment for prostate, as with most cancers, goes back to physical manipulation, either cutting it out or radiating it. So, sorry to not be clear, but the majority of what I talked about is for advanced metastatic disease, where we can't cut it out or radiate it out. We need treatments that go systemically. Yeah, so not that your team screwed up, it just wasn't relevant. Yes.
If you have metastatic prostate cancer and you know that the metastases are to bone and not to soft tissue, do you still do the genetic testing?
I do. So the genetic, the familial component you would do anyway. That's usually a swab of the cheek or just a blood draw. And then if we were to look specifically in the tumor, because we said there's germline changes and then there could be changes the tumors develop over time. What I usually do is follow people on treatment, and at the point where their PSA is going up, do a scan and see, is there a soft tissue component to any of the bone lesions? And then we would biopsy that.
And at this point, the patient that I care for has no soft tissue lesions, but has very advanced disease and a PSA of just under 200.
So you can still biopsy bone. It would be, if I have a soft tissue site, that's what I prefer, but it's not wrong to do bone. We just have to accept that potentially the genetic yield may not be as high, but we could certainly still try it.
Yeah, we have no family
Sure.
whatsoever.
Gotcha. Yeah. So it's still worth
But
certainly
you
a try.
still do the test?
Yeah.
Okay.
Yes.
Is there any testing of bone marrow regarding prostate cancer?
Not bone marrow specifically. So when people talk about bone metastases, it means that the cancer is growing in the bone, usually in discrete lesions. Most prostate people will be happy to know you don't need a bone marrow biopsy. I do them, but usually when we do bone biopsies, I'm talking about where is that focal rib lesion and putting an outside small needle in it. I don't do it, the radiologist would do it. Bone marrow biopsies are usually when we sample from the pelvis for blood-related cancers, where we suspect that the tumor is throughout the whole bone marrow. Prostate cancer usually is more focal, which is good.
Boy, I hate to interrupt this, but I have a duty to let you know that it is 3 o'clock, or just a couple of minutes after. I think you agreed to stay for a few more minutes, so I know this gentleman has one question, and first I just want to make an official thank you to Dr. Mitchell for doing this. I thought I was fairly aware of prostate cancer after 7 years of dealing with it, but today opened my eyes. So, thank you very, very much. Much appreciated.